Hey there, good evening everybody. This is Nawaz Modi Singhania from the Body Art Fitness Centers going live with you once again. This evening I am really excited to have a fantastic guest in with us, somebody who we all very much need in these times, but didn't realize it so pointedly till I think he comes in and starts talking to us. I'm seeing a lot of you guys coming in. Farzana, Priya, hey, awesome seeing you. Anu, Kasim, Carlos, Piyush, hi everybody, and thanks for joining. We have a super session. I'd like to, before I invite him in, I'd like to tell you a little bit about our guest. So, Dr. Prasanna Shah, MD, DNB, is profiled as Mumbai's leading consultant gastroenterologist, and he is attached to Mumbai's leading hospitals, including the Breach Candy Hospital, the Jaslok Hospital, the Parsi General Hospital, Sefi, and very many more. And I won't really talk too much about him because in terms of, surgeries, procedures, etc., because I'm really hoping with our talk today we can avoid actually ever getting into those realms completely. So let us just get Dr. Prasanna Shah in then. Okay, here he is. All right. So, good evening, Dr. Prasanna Shah.
Good evening. Good evening, Nawaz. Thank you so much for having me on this platform.
Thank you very much for agreeing to be on this platform. You are a very busy man and for very good reasons. So thank you. You're going to be providing us with a lot of very valuable information today.
Yes.
Yes. So I'd like to start with, without beating around the bush, I'd like to start directly with what is it in our gut feeling, in our gut sense, that makes us realize that a lot of the pandemic is actually stuck in our gut? Meaning to say that a lot of the fear and disability and job loss and anxiety and bitterness and anger and frustration and everything that is actually feels like it's having a very deep impact in the gut. It seems like emotions are very directly stored there, and there's a very deep impact right away, there and then. Could you shed some light?
True. So as I'm sure everybody knows that, the pandemic has really caused a chaos in everybody's lives. Since the last almost now 2 years, most of us have just been homebound. So there's been zero activity, zero exercise. Stress levels have gone up. People have got isolated. There is no human to human interaction. So therefore, one would say going out, getting that experience, getting the feel, dialogue between people to people has become less. So therefore, what happens is in our bodies internally is that the mind and the body both actually go in sync. Now, what is happening is now there is no sync because the body is locked inside, the mind is outside, because we were so used to a certain pattern, getting up, going to office, meeting, interacting, coming back, sleeping. That same lifestyle was going on, but now that is not there. So therefore, people have developed, or people do get what we call irritable bowel syndrome, IBS, which is a condition where the brain gut axis, there is a direct correlation between the brain and the gut. There is an axis. There are certain chemicals which are secreted by the brain which can affect the intestines, in which the intestines can react as constipation, as pain, as loose motions, or a combination of all the three. So there are 4 types of IBS. And so therefore, people have developed this. That is one. 2, what is happening to our internal milieu? the internal milieu, that is the internal environment of our gut, which was bombarded with a lot of bacteria by eating outside, now all of a sudden can change. So what does the gut microbiota do? So the gut microbiota basically has a lot of bacteria. They can be good bacteria, bad bacteria. There is yeasts. So there are many things which are there in our gut. When we eat outside, what happens is bad bacteria goes into our gut. All right. And therefore, the bad bacteria produces inflammation in the intestines, producing a lot of other effects. They have a cascading effect. So that is one which causes a problem, is bad bacteria. Because now of the pandemic, there is a lot of stress. Stress itself can again affect our internal milieu. Lacking of sleep, that can again affect our internal milieu. Lack of exercise, rise in weight. Some people have really lost weight while some people have really gained weight. Majority of the people have actually gained weight. All right. Uh, multiple factors there. People eating outside, ordering from outside, not eating at home. Then the diet has gone haywire. People are not eating the right kind of food. And so therefore, there are all these changes. To maintain a good lifestyle and to maintain a balance, you need a good protein, a good carbohydrate, and a good sugar. Now, all of that has gone for a toss. There's been a lot of sugar inside, there's been a lot of carbs inside, there's been less of proteins. And so therefore, the fat and the obesity has gone up. Other people have taken it as a challenge that they've been inside, so they have gone into a better lifestyle. So they have increased their protein, reduced their fats and carbs, and have also become better. So we've seen, both sides of the coin here. But predominantly, a lot of people staying indoors, unfortunately, have, gone the wrong way, in the sense they have got more acidity, more bloating, more constipation or loose motions, and very important, anxiety. A lot of people have developed a lot of anxiety. Now, this anxiety can affect the mind. And because it's affecting the mind, it's affecting the gut. Because I first said the brain-gut axis. So this is what we are. And in a nutshell, I've just told you how the things are moving around.
My gosh, you said a lot out there. Okay. I may ask you to slow it down and break it up for us lay people to understand it better.
Sure.
But thank you. Wow. So could you tell us, you've given us some signs of an unhealthy gut. How else would we know if our gut is unhealthy? What would we see?
So unhealthy gut means you have developed bad bacteria, which produces bloating, gas. So people come with tightness and bloating. The unhealthy bacteria produces inflammation in the colon, so you can develop pain. Unhealthy bacteria can produce loose motions. All right. So the classic example we give is when we take antibiotics, they're actually good. But what happens is the antibiotics flush away the good bacteria, and the bad bacteria predominate there. And therefore, you'll develop loose motions, and post antibiotics, one can develop bloating and gas. That's because the good bacteria which was protecting you is now gone. And so therefore, you need to replenish that bad bacteria by good bacteria by taking probiotics.
So besides probiotics, where would we get it in natural foods?
In natural foods, curds is the biggest, so that is what we advocate a lot of our patients to have curds twice a day. They can have it in the form of lassi or chash or just plain curds. So that is good. The other foods which we have are not for bacteria, but can be antioxidants. So, that is one. You can give good diet of vitamin C. You can give good fiber. So these all will protect your colon and, make sure that you have good stools.
Right. Thank you, Doc. We have so many people coming in and being very interested in what you have to say. And I'm going to say a quick hello to some of the people I saw come in. Bhavin, Ankit, Sumit, I saw Kamlesh, I saw Toral, Sagar, Prerit, Mangesh, Akash, Bhagyashri, I saw Ranjit, Ketan, Yogita, Zai, and Montu, and a whole lot others. But let's get on with this, because what Doc has to say is, and let's get going with it. Thank you, Doc, on that. So what would you say, how can we, besides what you've said in terms of the good gut bacteria and how to get your probiotics in, etc., what else is actually good or bad for the gut primarily?
That's a very broad thing to actually, explain.
Okay, sure.
But
in terms of nutrition, you've already addressed. You
yeah,
said something about nutrition and exercise and weight and the gut. Could you talk more on that?
yeah. So basically, good nutrition means you have a good balance of proteins, carbohydrates, and sugars. Now, some people cannot tolerate protein, some people cannot tolerate carbohydrates, some people cannot tolerate sugars. So in such a case, we usually take a help of a nutritionist who will plan a good diet for them, because some people who take carbs can bloat, so they are carb intolerant. Some people take sugars, they bloat, they get intolerant. So that's how we have to find out how their diet can fluctuate from place to place. Most important is what I tell my patients are, you need to have small portions of feed. You need to have frequent meals every 2 hours. Break it up. Don't have large voluminous meals. All right. uh, Make sure that your diet is good with fruits and fibers, vegetables. All right. You can avoid what we can call legumes, chana, rajma, some sorts of dals which can produce bloating and gas. So you can completely eliminate them from your diet. The the other thing is avoid fizzy drinks, which will produce a lot of gas inside. And we can also introduce good fruit diets. People can have fruits, and because fruits we know can be good stool softeners like papaya, banana, or you can have vitamin C like oranges, pineapples. Those are also good for their diet. So you can have a balanced diet keeping all these in mind, because every fruit has a certain nutrient value which can affect the colon. um,
Hmm.
Apart from small frequent meals, I think one very important part which everybody forgets is we are all busy. We are all in a hectic, mad life. And you know how Mumbai life is. Everybody is on the go. Nobody has time to really sit back and relax. So what we do is, because our mind is fast, our body is fast, we need to reach everywhere fast, we eat fast. Now, when we eat fast, we swallow a lot of air, and that is the most common cause of bloating and gas, which people do not realize. So, sit down, concentrate on your meal, what you're eating, see what you're eating, go slow, chew properly. The old age was you need to, swallow your food and chew your water, is very true, because what happens is when you swallow large chunks of food, let me give you a background. The esophagus, it just transports the food from the mouth to the stomach. Now, the stomach is an acid tin. All right. It has a lot of acid. It breaks down the food. Now, that food becomes a mycel, becomes a chyme. That chyme goes into the duodenum, goes into the small intestine. All the nutrients are absorbed. So, the small intestine is an absorber. The large intestine is an excretor. What we don't want gets excreted and it is out. So, if you do not chew your food properly, your your stomach cannot break down that big bolus of food or chicken or mutton what you've had. Sorry, it's not going to do that. It's going to get transported into your colon. The bacteria is going to ferment on that and produce bloating and gas. So important, chew your food properly, eat slow. When you're drinking water, purse your lips properly, because we can swallow a lot of air while even having water. So therefore, it's very important. These are some lifestyle changes one has to make. You've asked me which is a good way of, what are the good food habits. So these are good food habits to have, for a healthy gut. So lifestyle changes, anxiety, Please do not eat when you're anxious. We tend to overeat. Overeating again leads to its problems. So we do comfort foods, avoid that. Best is exercise. I think that's the best giveaway, or that's the best escape, is exercise. Go walk. You can just do simple walking also, is good enough, because by exercising what you're doing is you're hitting your physiology, and that is your basal metabolic rate, your BMR. Once the BMR goes up, you start losing weight, and everything starts moving fast. So lifestyle changes, food habits, these are two very important aspects of maintaining a good gut health. The third, we all are in the habit of eating outside. We all love to go. Saturdays, Sundays is outside. That's a norm, or it starts on Friday. Okay, if you have to go out and eat, make sure you have your proper dinner at home, and then you go out and eat a small bit. Now, what you want to eat out, you eat something hot. Don't have cold cuts, don't have salads, don't have the dressings, don't have all the others which are cold, which can have a lot of bacteria. Chutneys, we have a lot of chutneys. Avoid them. Have hot. We don't mind. You can have hot rice, hot dal. You can have hot Manchurian. You can have a hot plate of fried rice or your pasta, whatever. But it has to be hot. Nothing cold. So chaats and everything should be out. It should not be incorporated in a diet. So this is the most important food habit which I should tell everybody. And I have to stress on this.
Wow, that is huge. Very simple tips, you guys, that we're getting from Doc, but hugely effective. Sit down, eat your meal properly, make sure you don't get all that air in, and make sure that yes, that's fantastic. And this live is going to be uploaded, of course, and we guys are going to be going back and making careful notes on it. So thank you. Doc, what about other lifestyle changes? What about water? What about actual obesity?
Yeah. So water intake is important. And I've seen in my practice in the last almost now 19 years, a lot of people, they claim to have too much water, but they don't have that much water. Ideally, one should have around 1 to 1.5 liters of water minimum, apart from your tea, coffee, juices, soups, everything. All right.
Means about 6 glasses?
Yes, around 6 to 8 glasses per day.
Right.
So indirectly, let me tell you, if you pee at least 6 times a day, means you're doing well. If you pee less than that, that is not good. Very indirect. So people understand it that way.
Okay. People are asking if they can have cheat days, and I'm not going to ask you that question. I'm just reading as we go along. Okay. To all you guys.
No.
Preetham, Parizad, Faisal, Snehal, Tushar, Anjali, watching all you guys, Reena, Prashant. Hi, everybody. Anu. Sorry, Doc, I cut you in. Go ahead.
No, that's fine. That's fine. So water is very important, because we've seen a good water therapy, or just let's put it as hydration therapy, actually helps in good bowel movements, because your stools require a lot of water to be formed, fiber and water, these two things. So if your water content is less, if your water content is less, what is going to happen is you're going to have constipation. And then you get into that whole rut of laxatives, of changing your diet, and all those things. Plain simple water. Have plenty of water. Your bowels will be well regulated. But there's a footnote. Anybody above 65, cardiac issues, water restrictions, kidney patients, if they have water restrictions, yes, that can be a little difficult to manage. Then you are walking on thin ice there. We really need to manage their diet and their water intake accordingly, according to their physicians, especially for those groups which I told you who are kidney patients or cardiac patients.
Right.
Regarding obesity, now, obesity is huge. It's a huge problem. Let me tell you, folks, if you think COVID is a pandemic, obesity was already an existing pandemic and nobody knows about it. The actual status and the data is, in India, there are 135 million overweight people, out of which half of them are obese. It's a huge, huge number. All right. And we are talking about BMI just above 24.9. We're talking about 25 to 29. So that's overweight. Then you have grade 1 obesity, grade 2 and grade 3. That is from 30 to 35, 35 to 40 and above 40. There are many therapies which are available for obesity. But let me tell you why obesity is so important. Because we are literally the capital of diabetes, blood pressure in the world. You know, we have people who have metabolic syndrome X. That means you have diabetes, you have blood pressure, you have obesity, you have triglycerides. So that's metabolic syndrome X. And there's a huge amount of population, not only above 50, but we are seeing it now from 30 onwards. That's all because of the lifestyle and the food habits which we spoke earlier. So, metabolic syndrome X and obesity, bad. What does obesity do to our bodies from head to toe? It can cause cardiovascular accidents, that is stroke. All right. It can cause sudden cardiac death. It can produce obstructive sleep apnea, which can again affect your breathing. And because you have sleep disturbances, you can become, it's a vicious cycle. Obesity, sleep disturbances, and again, the obesity can get worse. So that is the problem. Me as a gastroenterologist, my main organ is the liver. The liver, the fat gets stored into the liver. We get a fatty liver. That's a very common word, I guess everybody has heard. Fatty liver, fatty liver. What is fatty liver? Abnormal accumulation of fat in the liver is called fatty liver. Graded, grade 1, grade 2, grade 3, and grade 4 is NASH, called non-alcoholic steatohepatitis. And for those people who are having alcohol steatohepatitis. When it is grade 1 and 2 and 3, we can reverse it. The take-home message, up to grade 3, fatty liver can be reversed. Grade 4, we are harboring close to cirrhosis. Cirrhosis is the end game. So if you lose weight, if you control diabetes, you control your cholesterol, then your fatty liver can be reduced. There are multiple new molecules which have come to reduce fat from the liver, but I would stress more on lifestyle and food habits and exercise. I think this is very important. The thing with obesity is we've seen a lot of people who get frustrated by obesity and they really don't know what to do. They say, Doc, we've done everything. We've done gymming, we've done lifestyle changes, but the weight just doesn't seem to budge. In that sense, where we come into the picture is, as endoscopists, there is a new branch called Endo-Bariatric Procedures. Through endoscopy, we do bariatric procedures. Now, I'm sure everybody's heard the word bariatric, So bariatric procedures are weight loss procedures where they cut the stomach into half, or they do bypass surgeries, or there are other newer things which have started coming. But we don't advocate surgery. We, being endoscopists, gastroenterologists, this is a new branch which is called endo-bariatric or metabolic endoscopy, where we can change your metabolism by doing what is by simply placing a gastric balloon in the stomach. It's a silicone balloon. It's put through the mouth and again removed through the mouth. I've had the maximum experience in India. I've done more than 300 gastric balloons so far with very good results. We've really had some good results there, and it is a procedure which is an OPD procedure. You need not get admitted, and we put in around 500 cc of water. There's a certain lifestyle and diet one has to follow, and you do lose weight. And after 6 months, we just pull it out of the mouth, and you go back. The advantage is it's completely reversible. It does not alter the anatomy of your stomach. We are not cutting anything, so therefore your stomach is preserved. The internal lining of your stomach is preserved, and therefore you will not have any long-term effects like carcinoma, gastric carcinoma, deficiency of intrinsic factor, your parietal cell anemias. All that is out. Nothing happens. So that is one procedure. The second procedure which we've started doing is endoscopic sleeve gastroplasty. Sorry, it's a little technical. Simple words. Through endoscopy, we pinch the stomach in 6 to 8 places, make the stomach small, and that's it. Still, we're preserving the lining of the stomach. We are not cutting anything. And this procedure, the effect can last for 3 years. So that's the advantage of these two procedures. There are many other procedures which are coming. We have the variable size balloon, where the gastric balloon can be inflated and deflated according to your the amount of weight loss you want. Then there is something called as a transpyloric shuttle. The new thing which everybody will be hearing soon is a stent. It's a sleeve which we place from the stomach all the way into the small intestine. So it kind of bypasses the whole duodenum, and therefore you lose weight. That's one. Or we burn the internal mucosa of the intestine, called duodenal mucosal resurfacing. And that's where, again, obesity, the whole metabolism of obesity is basically in the second and the third part of the duodenum, where all of that gets altered and you lose weight. So there are a lot of new procedures which are coming. But all I want to tell you is all these procedures are safe. They can be reversed, especially I'm talking about gastric balloon and endoscopic sleeve gastroplasty. Uh, and so far, mortality or death rate is nil to negligible. You don't have to get worried about it. There are certain few side effects uh, of the procedure which can be dealt simply by just giving medicines. But if you look at the good side, the effects are much good. And what I have seen, Nawaz, is when patients start actually losing weight and they see that weighing scale actually tipping, to the left side and not going to the right side, because right side is always increasing. Once it starts going to the left, you realize that you're losing weight, and it makes them so happy. It makes them unbelievable. I still remember this one incident almost 7 years back. This lady from Bhopal who had come, and I put the balloon, and she lost a moderate 10 to 12 kilos. But she says, "Doc, you don't know how important it is, because finally, after losing this weight, my husband has started noticing me." And that was such a huge impact.
Yes.
That kind of really shook me up. I said, "Oh my God, it's unbelievable." But more than that, we can reduce fatty liver. The fat in the liver can be reduced. We can make the liver normal, and that's important. But apart from these procedures, the baseline is good diet, good exercise, good diet, good exercise. So that is important.
Yeah, wow, that's a lot of information, very valuable, and thank you so much, Doc. And I totally get where you're coming from, but I can't help but feel that these are all sort of endgame, life-saving, techniques. What is it eventually going to do to your cardiorespiratory fitness, to your organs? I mean, you'd better take care of yourself on the top end of it rather than having dragged yourself down to this point where you need such a major intervention.
So uh, it's a very valid point, because a lot of people tell us this. The point is, till you don't intervene, okay, you're not going to get the desired result. And intervention means these are not interventions which are going to change your internal organs or anything of that sort. No, we're not changing, we're not cutting. It's a single direct, oral cavity in and out. There are no cuts on the abdomen, nothing of that sort. Now, when you lose weight, what happens is you become cardiometabolically fitter. That is very important. Now, there was a study which has been done by gastric balloons. So there are three arms, one with gastric balloon, one with gastric balloon exercise, one with diet, exercise, and gastric balloon. So one was diet, second was diet, exercise, and gastric balloon, and the third was all the three. And they realized the one with the balloon lost 3 times more than the weight with just dieting or diet and exercise. So obviously, some intervention is required. This is not a very massive intervention, I would say. This is just a minor intervention, because there are no cuts or anything of that sort, and you don't need to be hospitalized for it. It's an OPD procedure. You come in and out, and that's it. So this study actually showed the value of a gastric balloon, where they showed that the weight loss was double to 3 times more than those two arms. So obviously, some intervention, some form of intervention is required when you're really pushed at your wit's end, or your back is against the wall.
Right. So it's a kind of a great add-on to your lifestyle, your nutrition, your exercise, your everything else, your sleep, your everything else, to
Yes.
really get to that finish line, which you may not be able to get to on your own.
One more armamentarium in your hand. So
Yeah.
it's good. Apart from what you have, yes, you have good exercise regimes, you have good diet regimes, you have a lot of fad diets. A lot of people are doing that, but the point is, finally, to get to that, you might require or you may need these intervention. It's very subjective to people who want it, who do not want it. So that's it. I must be counseling more than 50 to 100 people on obesity, but finally only one or two come for a procedure. So it's because a lot of people say, doc, we'll just diet and exercise. And I'm like, fine, go ahead, diet, exercise, it's great. But if you don't, then, there is a backup. Now, people say, doc, but if this fails, then what? Finally, in finality, one can go in for a bariatric surgery. So
Yes.
that's the final thing one can do.
Right. I'm sorry, I may be taking you back slightly, but I think it's such an important thing to understand for all of us that am I getting from you that negative gut health directly leads to obesity?
So the gut microbiome is very important because they are slowly now there is a lot of study which has come as gut microbiome or the gut bacteria can actually propensate obesity. So bad bacteria can actually give or can make you obese. So there are complex pathways which are there which can lead to obesity, and therefore the stress and the importance of good bacteria in your gut is very important. The good bacteria is you have Saccharomyces boulardii, that's one. You have Bifidobacterium, that's a second one, which we require. And there are many more other bacteria. So they are called probiotics. These are good for the colon.
That's an important point and probably something, yes, not easy to understand that, okay, that actually leads to obesity in itself and we need to watch out for that.
Yeah.
Super. Thank you for shedding light on that. Doc, why is it that over a certain period of time, age, etc., guts tend to, these senior citizens seem to have more trouble with their gut and digestive system? Why?
Yeah. So let me get down to some basic which people really don't understand. What is the definition of acidity? Acidity is acid in the stomach. Now, acid causes burning. All right. So that is acidity. What is the other one? Bloating. What is bloating? Bloating means there is actually gas in the stomach which distends your abdomen. That's called bloating. When it comes to a point where it is tight, it's called tightness, like a drum-like tightness. You can literally, it's your abdomen becomes a drum. So that's important. What is loose motions and constipation? Because people use these words very freely. Doc, I'm constipated and I pass 3 times. 3 times a day I pass stools and I'm constipated. Hello, that's not constipation. Or people say I have loose motions and I pass only once a day. I say, hello, that's not loose motions. More than 3 loose stools per day is loose motions. Constipation is less than 3 bowel movements, literally more than, fewer than 3 bowel movements in a week where the stools are hard to pass. Dry, lumpy stools is called constipation. So these are certain terminologies one has to understand.
Right. Thank you. But why is it that the senior citizens seem to be having this issue more than youngsters of the gut and the digestive system generally being weaker? Why?
So what happens is as we age and as we grow old, the intestines also slowly start becoming slow. The metabolism starts becoming slow. A lot of people have diabetes, blood pressure, and other issues. People might have constipation. People have certain disease called diverticular disease. I'm sure people must have heard this word diverticuli. These are basically out pouches in the colon, and they cause more constipation. They cause weakness in the colon, and therefore elderly population are more prone for diverticular disease and constipation. So this is one of the reasons. It's basically a natural process of our body slowing down as we grow old. On top of it, we have diabetes, blood pressure, we have other comorbid conditions. Plus, our lifestyle doesn't change. You see all the elderlies, in spite of having diabetes, they'll still cheat on sweets. They would want the craving of sweets. They would want that. They don't listen. When you tell them lifestyle, the classic answer I get from elderly people when I tell them, try and avoid this, is a doc, how many days we have left? Let us live as much as we want to live and happily. Okay, but it's a valid point which you're making, that as we grow old, our systems are going to slow down. Our metabolism is going to slow down. It's not going to remain as great as what it was when it started. More so because it has been, you know, it has been dogged, or I would say it has been stressed by metabolic syndrome, that is diabetes, cholesterol, blood pressure. Mind
Hmm.
you, I've not even touched upon alcohol and smoking as a very bad effect to gut and liver and the GI system. That's a whole different topic. But I can just tell you in a nutshell, alcohol and smoking are bad. We should not, uh, because they have their own ill effects. And tobacco, really a bad ill effect. We are seeing a lot of cancers. I don't want to scare people, but I can tell you that yes, we are seeing a lot of cancer coming up because now tobacco is chewed, is smoked, is we have masheri. It's put on the teeth, so, and it's pan, gutka. There's so many forms of tobacco, and therefore you'll be surprised to know, Nawaz, that carcinoma of the esophagus is the number one cancer in our country. Then comes the head and neck cancers. Then come all the other cancers. It is so much.
Wow. Many
So
going off in the head because
yeah.
of you today. Thank you. Gosh.
So
No.
it is very important that, because elderly people have been through so many years of alcohol or smoking or whatever, and the effects of alcohol and smoking are not immediate. The immediate effect is great. You feel wonderful. It puts you in a good high. It relaxes you. But the final terminal effects of alcohol and smoking are not great.
Yeah. And why even it is that one has to take to it and what they're blocking there is a whole other story also. Why one needs to rely on it. Yeah. But let's
Yeah.
not go there for
Thank you.
today. Yeah.
Yeah.
Okay. I'm sorry I have to keep doing this, but we have so many others coming in. I want to quickly say hello, Sohail, Nargis. I saw Poonam, Kamlesh, Pankaj, Ali, Sonu. I saw Sam, Priya, Sajjan, Millie, Vikas, Anshuman. Thank you for joining us. It's a very, very interesting session. Doc, do you recommend any particular annual tests regularly, gut related?
Excellent question. I think this is something which not many people ask, but gut related, I think people now are slowly doing their annual body checkups. We are seeing a slow rise in our hospitals where people are coming and doing annual checkups. So annually, one should do their usual complete blood profile. They should do their liver function test. They should also look out for tumor markers. That is important. Get a sonography of the abdomen done and do a simple stool test with occult blood. These are important to be done.
Hmm.
Above the age of 50, what is recommended is a screening colonoscopy. I don't know whether a lot of people know about this or not, but in the West, it is usually advocated that above 50, one has to do a screening colonoscopy because you can have polyps in the colon and these polyps can become malignant and they can cause CA colon. Now, the Western population is a huge meat eating population, and therefore, they advocate this more aggressively. While here in India, we are a more vegetable, fiber, antioxidant eating population. So our incidence of CA colon is not much, and therefore we really don't strongly advocate uh, screening colonoscopy. But mind you, a lot has changed. In the last 15 years, we are slowly seeing a resurgence of all the cancers, including colon, pancreatic, esophageal, lung. They're all coming back. Stomach, they're all coming back. And uh, that is because of food habits, dietary changes,
Hmm.
alcohol, smoking. A lot. In 15 years, if you see, lot of people have changed their food habits. And therefore, we are slowly seeing this resurgence of cancer. Another thing is also genetic, unfortunately. So
Hmm.
those people have to be more aggressively screened. So at 50, get a screening colonoscopy. If it is normal, great, straight at 60. But if you find polyps, we remove the polyps there and there. Depending on the shape of the polyp, histology of the polyp, one advocates screening colonoscopies of every 3 years or every 2 years. That is for the colon.
Hmm.
What about
Hmm.
the esophagus? A lot of people have reflux. We are talking about gastroesophageal reflux disorders. That's GERD, acidity, bloating. You have heartburn. That's a common symptom. People have meals, people have smoking, alcohol, go to sleep. They get up, they say, Doc, we got up choking. We have some burning in the chest. We do an endoscopy and we find that there are ulcers in the food pipe. We find that there is a swelling in the lining of the stomach. Important to know here is Helicobacter pylori infection, which is a bacterial infection which affects the stomach lining and can lead to gastric ulcers, duodenal ulcers, and malignancy of the stomach, what we call maltoma. And therefore, H. pylori is a class 3 carcinogen defined by WHO. So it's important that one sees for H. pylori if they are undergoing an upper GI endoscopy for any of the upper GI symptoms. But the reason why I said upper GI is we talk something called as Barrett's esophagus. What's Barrett's esophagus? It's a cancerous condition. It's a cancer of the food pipe because of chronic acid reflux, which can be completely reversed in the early stages if detected early by aggressive antacid therapy. So that is one thing which you have to also look out for. So what is the new thing? We have a pill. You just swallow that. It gives you images of the food pipe. We can see whether there is Barrett's esophagus or not. Images of the stomach and the small intestine. It's called capsule endoscopy. One can do that if they don't want to undergo endoscopy. But mind you, it is expensive. So therefore, a lot of people go for upper GI endoscopy itself. Apart from other screening, okay, we do, as I said, stool occult blood we do. We can do stool fecal calprotectin. Sonography can be done regularly. So these are the tests which we advocate normally. And above 50 normal, we tell them get ECG done, get your blood sugars done, get your blood pressure checked regularly. But from a gastro point of view, these would be the most important tests. Of course, I'm forgetting that we need to do hepatitis B, hepatitis C, and HIV markers. They are very, very, very important because hepatitis B and C can be a silent disease, and patients can only present as cirrhosis of liver, and you don't even know that, oh, I had hepatitis B or C because of probably contaminated needles or blood transfusions earlier. Now the incidence is much less because there are strict protocols and guidelines in the hospitals. So therefore, now the transmission of hepatitis B and C in the hospitals is literally nil. And there is also very good therapy now. We have good tablets and injection therapy for hepatitis B and C. So it can be completely cured. I don't think one has to get really scared about it. So these are all the things one has to do. I'm sorry I'm going fast because there's so much to give you information in a short time. So therefore, I'm just going fast.
Yeah, no, after hearing you, I don't know whether we're more scared about the information you're giving us or more scared about COVID or all of that. But yeah, I think by and large, while everything you say is very, very valid, a whole lot is taken care of by having a healthy, good, decent lifestyle, sleep, exercise, food, keeping what's up there clean, clear, stress-free, etc., etc. A lot of this can be eliminated, and one doesn't need to get hyper and kind of, a bit of a hypochondriac in terms of all of these things out to get us. So yeah, but very important to be well educated on this. So thank you so much. Please tell us what is, you must have been asked this question a million times. You must be tired of it. But I sense that you have something very interesting to tell us about the old adage, go with your gut feeling. And scientifically, what is it that really the gut has to do with the sixth sense or an uncanny sort of an uncanny instinct? Is this valid?
I think it's just it's difficult to explain, but as they say that the way to the man's heart is through the stomach. So something like a sixth sense, a gut feeling, you get this nervous or you get this churning in the stomach, and that kind of just tells you, oh, something is wrong. It's probably again the brain gut axis where the brain starts to recognize that something is off, and immediately it kind of reflects in your tummy. I think that's the only valid explanation I can give you. But yes, I have a gut feeling. I hear this a lot. Can't really explain as to what could be the real thing about it and how it came about. I think even I need to read that actually.
But that makes it very valid, because if the brain is playing out in the gut and that is where you're going to see the whole thing projected, that makes it valid. Yeah.
Yes. So it's all about the brain, which sends you your signals. It's the brain which is controlling everything. So it's all the signals. So therefore, as I'm again mentioning, it's all the brain gut axis, which puts me to a point of any other alternate therapy which people ask me. So there are two things which I tell people also you can do is pranayam and shavasana. Yoga is good to calm the mind, because a calm mind is a calm gut. An active mind is an active gut. This is simple.
Right, which is why we've all zoned out about the new COVID strains. Don't care, don't know, till it's determined upon why stressed, right? What's the point? So, yeah, yeah.
I think regarding COVID, let me just tell people, don't get so nervous or stressed. It is simple. Mask up. Everybody's just doing that. Just do your bit. Just wear your mask and you're fine. And that's about it. Sanitize your hands and avoid crowded places. I mean, I know we are all frustrated. Go out. I'm not saying no, go out. But just put your masks up and you're just protecting yourselves. That's it. And don't get, oh, it's this strain and that strain and which strain I'm going to get. I have to tell you, Nawaz, there was a very good study in British Medical Journal which showed people who were vaccinated, double vaccine, who got COVID were very mild disease. The CT score was 0. So those patients who've had a double vaccine, if you get COVID also, do not panic, because the disease is going to be very mild. Literally, the vaccine is like a kavach. It is protecting you. So take the vaccine, take the boosters. I mean, take the second shot. Boosters will come in, I'm sure, but take the vaccine. My message to everybody: take the vaccine, because still people are contemplating, should I take, not take? Oh, I got this, I got that. Look, vaccines are new. You will hear, oh, I heard this vaccine did this damage, that vaccine did that damage. They've all been temporary. There have been very, very few reported deaths, but that is in a population of 7 billion. So please do not get perturbed or nervous about the vaccine.
Very important advice. Yes, guys, I hope you're listening. Thank you, Doc. And I wanted to also say that after taking your second vaccine, what's equally important is don't think that you've suddenly become Superman and start challenging your fate and go out there and do some dumb things, because, hey, you're asking for trouble.
Correct. Absolutely right.
Yeah, yeah. Doc, I've taken up a lot of your time, but I still have just one more thing. Still seeing tons of others joining in and having very valid comments out there. I'm seeing Anshuman, Pooja, Dylan. Hey, I'm seeing Shama, Anil. I'm seeing Ma, Kalisha, Arjan, Ajit, Karthik, Sajid, Vivek. Hi, Shashank. Hi, everybody. And I'm sorry I cannot mention everyone here because we're trying to get the most of our time together, but hi to all, watching you all come in and your comments, etc. Doc, just one last thing. Any final words of advice to us? Any further ways to improve our gut health, or anything you would want to tell, I don't know, somebody you deeply cared about on the topic eventually? Yeah.
So I think important is avoid eating fried feeds and chilies and oily stuff. Make them to the bare minimum. Do not indulge in spicy foods and oily foods. They might taste great, but avoid doing that. Eat every 2 hours, as I again told you. Eat every 2 hours. Small meals. Please portion your meals. Don't overindulge in food, and don't, starve yourself also. That's also wrong. So eat to the bare minimum every 2 hours. Like we literally say 8 o'clock, 10 o'clock, 12 o'clock, 2 o'clock, 4 o'clock, 6 o'clock, 8 o'clock. I've given you almost literally, I've given you 10 meals. And in between could be snacky stuff. It could be a bowl of fruit. It could be, a sandwich. It could just be some dry fruits. It could be juices. And that's it. That is 2. 2, avoid alcohol, smoking. Sleep early. Very important to sleep early. You should have minimum 6.5, 7 hours of sleep for a good resting brain. Because as I said, a stressed mind is a stressed gut. A stressed gut is an inflamed gut. An inflamed gut is bacteria full of, is a gut full of bacteria. The bacteria is going to cause problems. So it will cause indigestion, it will cause pain abdomen, it can cause obesity and all those things. So have adequate rest. Do some exercise, physical activity. Yoga is not physical activity. I would say exercise. You can do treadmill, you can do cycling, you can do elliptical, you can go swimming, you can just go for a walk. Just go for a walk. Walk every day for half an hour to 45 minutes, because it slowly builds your basal metabolic rate going up. And that's where you will achieve a good sense of well-being within, because your mind is going to be relaxed by the walking, and
Mm.
also your BMR is going up. So your digestion improves, everything. It all has basically a positive effect. That's what I'm trying to tell you.
Yeah.
Increase BMR, and you do that by exercising. Most important, detox yourself from the phone. I've seen that. When you're going to sleep, you don't need to send good night messages to everybody in the world that you're sleeping. Everybody knows you sleep at this time. Just detox yourself. Half an hour, 45 minutes, switch off your phone, give yourself some me time, think about yourself, and go to sleep. These are some very important few things one can do. Yes, people will ask, Doc, you've told us a life where, we have to literally live like a priest or a nun. No, you can have your cheat days. You can have, alcohol you have once a week. It doesn't matter. You can have sweets once a week. It doesn't matter. But make sure you counteract that by having good lifestyle like diet and exercise. These are very important.
Yeah.
Introduce fruits in your diet. Introduce curds in your diet. These
Mm.
are important. Have good fiber. Just don't be on a non-vegetarian diet. Have a good vegetarian diet also. So you would know that, you know, uh, these are important for gut health. So
Mm.
all these are very important. Me being allopathic, we give antibiotics. Try basic minimum antibiotics. And if you take an antibiotic, make sure you're taking a probiotic along with it, so you protect your gut. That is important. So
Mm.
these are few very important things one has to really learn about, your gut. Yeah,
Thank you, Doc. That really summed it up very well. And you guys, when you get bored of your basic exercise routine, come and join us at Body Art, online, offline, all of that.
exactly.
So, Doc, you are quite evidently no proponent of intermittent fasting at all, except for when one is sleeping. Yeah,
So
important.
as I said, a lot of fad diets are there, but I
Yes.
think you do what you feel is the best. I think that's the only thing which works, because if you try to restrain somebody, I've seen the bounce back effect is more worse than what it was.
Yeah.
So intermittent fasting, yes, it does work, but I've seen patients with intermittent fasting not doing well, some doing very well. So it's a mixed bag. All these fat diets, it's a mixed bag. And I don't think I don't think I have the right scientific knowledge to give you about intermittent fasting, Dikshit diet, and 16 hours, 12 hours. I don't think I have that much reading, to be very honest. But I can just tell you is that basic carbs, basic proteins, less sugar is good for your health. I think
Mm.
that's really keeping it very simple.
Straight and simple. Yeah. Yeah. Thank you, Doc. We are almost up to an hour. Thank you.
Oh, okay.
It's been really, really beneficial. We're going to go back and take our firm notes on it. And thank you, all you guys, for joining.
Thank
Uh,
you.
thank you. It's been wonderful and very informative. And stay well and safe, all you guys.
Once again, thank you, Nawaz. Thank you so
Thank you.
much for this opportunity. Thank you. Take care. Bye bye. Good night.
Good night.